Hello, my name is Melissa Weinman. I am the Vice President of Quality at Methodist Hospital, Stone Oak. My background is nursing for 31 years, and I have been with the quality department for the past 10 years in various roles.
My name is Courtney Burgoon. I'm the Director of Patient Safety at Methodist Hospital, Stone Oak. Been a nurse for a little over 11 years and have been in the quality patient safety department for around 3 years.
So Methodist Hospital Stone Oak had a number of inpatient falls where the post-fall imaging was delayed up to 14 hours due to imaging orders being entered as routine. This delay prolonged result time for imaging and diagnosis and delays in patient care due to potential injured patients. In the response for the systematic approach to responding to an inpatient fall with potential injury, Methodist Hospital Stone Oak developed a rapid response team and fall alert to address promptly caring for injured patients or potentially injured patients, as well as to expedite orders for treatment and diagnosis. The alert activates care team members who routinely care for injured patients, including a trauma assessment, notification of the findings to the attending provider. The attending provider notifies the on-call trauma team when needed to decrease the time from fall to diagnosis or to rule out injury with a goal of 2 hours or less. So some of our design and strategy around this project, we started in July, and we had different varying meetings with key stakeholders, being our CNO, CMO, ER, ICU, inpatient directors, radiology, laboratory, and of course our trauma coordinator and our trauma surgeon. We had various meetings, and we developed this system to roll out. And then we had to get approval from our MedExec committee. And this was really in partnership with our surgeon, who was able to take it forward to the different committees for approval. He was a key stakeholder in getting this project approved, along with our CNO and all the inpatient directors who were just really rallying around this as it was something that we felt that we needed to do for our hospital. So when everything was passed, we had education, we had a target goal live date, and then it was rolled out. And so from there, the results.
So we, post-implementation, tracked this over about a 3-month period. The average time from fall event to imaging result actually decreased from about an average of 5 hours and 16 minutes to 59 minutes. This 59-minute average included a 171-minute outlier that required emergency surgery unrelated to the fall. So when you take the outlier out, the average is really 43 minutes. So these results just showed a significant improvement in timely care. One area that we identified to be out of scope when we started implementing the process was our inpatient rehab facility, which is actually an off-site facility. They don't have critical care nurses or trauma-trained nurses, so without having a rapid response team, they are still focusing on getting stat orders anytime there's a fall with a concern for injury, and we are continuing to track that as well. And overall, just continuing to monitor for opportunities if patients met criteria for an RRT and it wasn't called, as well as tracking the stat post-fall orders, even if an RRT wasn't called. Overall, we really just want timely care for patients, especially if there's a potential injury. So really, the post-fall treatment has improved, and we were even hearing reports of improved times and improved stat orders prior to our go live date, just because of the great communication amongst our physicians and staff.
Thank you.